Welcome to today's topic, complications of osteoarthritis, on the platform of Mature Healthy Life Video Productions. In today's topic, we are going to talk about the complications of osteoarthritis. Though in our last video, we talked about the signs and symptoms of osteoarthritis. That brought us to today's topic. Number one complication of this condition is persistent pain. Yes, persistent pain, pain that doesn't go away, which may lead into unexpected fall and thereby sustaining injury. Is a very critical complication, so don't joke with it. Another one is anxiety. In the presence of complications of osteoarthritis, there will be a presence of anxiety. When a patient or an individual is anxious about his condition, of course he has to be anxious because the normal activities that he used to perform unaided are no longer there. He can no longer perform them as he used to. So he will be anxious. And in the presence of anxiety, depression will follow. Another one is sleep disruption. In the night especially, there will be a serious aching in this joint, which will actually disrupt sleep from this patient or individual. So sleep disruption is also a complication of osteoarthritis. Another one is reduced productivity. Your productivity in a day or in a serene will reduce. It will be reduced. Productivities like your household chores like putting the house in order, cooking, getting dressed, taking exercise, your household chores generally will reduce. Even your official activities will also reduce. So these are the complications of this condition. Another one is weight gain. When there is weight gain, the presence of other metabolic diseases or conditions may set in. Things like diabetes, things like hypertension, things like heart disease, they may also set in. These are the critical complications of this condition. Another one is osteonecrosis. Osteonecrosis is the death of the bones. The underlying bones that make up the joint will start dying. Yes, we call it osteonecrosis. This is also a complication of osteoarthritis. Another one is stress. If you overstress the joints or the bones, it may lead into fracture. Yes, it is called stress fracture. It is also a complication of this condition. Another one is bleeding / infection. There can be bleeding because of the fact that the synovial fluid and the cartilages that cushion this joint, that makes these two underlying bones not to jar together, they have been reduced, thereby allowing these bones to jar together. And when they jar together, blood will start flowing inside. Internal bleeding will set in there. And when there is bleeding, infection will set in. And when infection sets in, you see that it is fast leading into that osteonecrosis, which is death of the bones. This is also a complication of this condition. Another one is deterioration of the tendons and ligaments. The tendons and ligaments that connect the tissue from the bone, of bone to tissue, they will start getting weak. Yes, the tendons will start getting weak as a result of this condition. So it is also a complication of this osteoarthritis. Another one is speech nerve. The nervous system, the nerves that sends message into the brain, especially through the spine, they will start getting weak. When they get weak now, there is a problem within the spine and brain. So this will make you to understand that the complication of osteoarthritis is not a child's play. So don't joke with osteoarthritis. Please, anytime you have osteoarthritis or you see someone that has it, try and help him. Go to your doctor and start handling your condition on time. Thank you so much as you watch this video. Please share it, like it, comment on the comment section. In our next video, we shall talk about the management of osteoarthritis and how to treat it. Thank you so much. Subscribe to our YouTube channel. Follow us on our Facebook page so that you get our update each time we make productions. Thank you so much as you do.